All right, we just gonna get into it, and people could catch the playback on YouTube. Okay, thank you guys so much. All right, so let's just get into it. All right, so now I am using ChatGPT to break this down to us, and again, we're talking about the differences between liraglutides, dulaglutide, semaglutide, and tirzepatide. So when we talk about liraglutides, Keisha, what is liraglutides? We're talking about your Saxenda and your Victoza. I know a lot. Now I started out with Saxenda, and then Victoza is something that I know a lot of people take. Y'all, I know a lot of people who have taken Saxenda and Victoza and have gotten to gold. Okay, so that's your liraglutides. The liraglutides are Saxenda and Victoza. Your dulaglutides is your Trulicity. Okay. If there's anybody in the chat that is on Saxenda or Victoza, raise your hand. Anybody in the chat on Saxenda or Victoza? For the 67 people who are in the chat, if you're not yet following me, click this picture. Make sure you're following me and turn your notification bells on. We're talking about the differences between liraglutides, dulaglutides, semaglutide, and tirzepatide. You never heard of that, Charlotte? Yeah, Saxenda is the injectable that you take once a day. Girl, that's what I started with, and it was just too much. I could not do that every day. And my side effects was just horrible, girl. I couldn't do it. And then I switched over to MOUNJARO. Okay. Trulicity is your dulaglutide. Anybody taking dulaglutide? Trulicity? Trulicity is very good. It's very good. Your semaglutide, that's your Ozempic, Wegovy, Rybelsus. Rybelsus is the oral form of semaglutide. Raise your hand if you knew that Rybelsus was the oral tablet of Ozempic. Raise your hand if you knew that. For the 90 people who are in the chat, y'all share the live with one person. Drop me some FYP so that we can get back on the FYP. If you're not yet following me, click this picture. Make sure you're following me. Turn your notification bells on. You guys, this is a Amble sponsored live. I want you guys to remember that Amble does offer branded versions of these meds as well. So this is why we're talking about all the things, okay? Is there anybody that did not know that Rybelsus was the oral form of Ozempic, semaglutide? Okay, and then your tirzepatides, that's your MOUNJARO and your Zepbound. So we're talking about liraglutide, dulaglutide, semaglutide, and tirzepatide. I'm going to tell you guys what the differences are, what the benefits are, what the contraindications are, because a lot of us think that we're on the best MED, and you may not be. You may need to be on one or the other, okay? I heard of them, but didn't know what family they belong to. Yes, baby. So I'll tell you again, Saxenda and Victoza, that's your liraglutide. Your dulaglutide is Trulicity. Your semaglutide is Wegovy. Ozempic, your tirzepatide is Zepbound and MOUNJARO. Oh, did you get LIPO C, Coco? Girl, you're going to love it. You're going to love it. Okay, so let's get into liraglutide. We're talking about Victoza and Saxenda, okay? I'm teaching you guys the difference so that you know. And listen, I'm not teaching you so that you can change. I'm teaching you so that you know in the event that your MED stop working, there are other options. You know how I tell y'all when y'all get to stalls, it's time for you to do something different. You either need to go up in dose, or you need to go down in dose, or you need to switch it up. It's just so that you're familiar, okay? And everything that I teach you on my live, you need to go into your patient portals or to your doctor's office and talk to your doctors about this. And when they talk to you, it won't be the first time that you have heard this, because Charge Nurse Keisha be getting y'all together. Okay, put this in the refrigerator for me.
11:30. Check for me, Mom.
Okay.
That's
all right.
34 minutes.
Okay, so let's start with liraglutide. Okay, what are the benefits of liraglutide? We're talking about Victoza and Saxenda. It's proven to get you LBs down. Daily dosing can help titrate gradually. It improves your A1C levels. It reduces cardiovascular risk in patients who have diabetes. That's the benefit of a liraglutide. That's your Saxenda and your Victoza branded. Okay. Now, when it comes to dulaglutide, that's your Trulicity. If there's anybody that is on Trulicity, raise your hand. For the 130 people who are in the chat, click this picture. Make sure you're following me. Turn your notification bells on. If you are looking to start your GLP-1 journey and you want to be under the umbrella of a clinician, all you have to do is come to my TikTok profile and look for the LINK for Amble, okay? Dulaglutide, that's your Victos. I'm sorry, that's your Trulicity. Dulaglutide is your Trulicity. Trulicity is conveniently a weekly dose. Saxenda and Victoza are daily doses. Your Trulicity is a weekly dose, okay? And y'all, I'm going to post this on YouTube, so you don't have to write nothing down. Just listen, okay? It lowers your A1C level effectively. It's proven to reduce cardiovascular risk. It gives you mild food consumption suppression, okay? That's your Trulicity, once a week dosing. Your semaglutide, that's your Ozempic, Wegovy, okay? It's the strongest GLP-4 LPs down, okay? So far. It has a robust A1C lowering, okay? It improves your insulin sensitivity. That's the GLP-1. Improves your insulin sensitivity. What does that mean when they say improve insulin sensitivity? That means after you eat, your body, your pancreas, or your body, let me just say this. Your body starts breaking down carbs and breaking down fats, metabolizing them the way they're supposed to be metabolized, eliminating them and or storing them the way they're supposed to be stored. That's what your GLP-1 does, okay? It also improved fatty liver markers. Does anybody in the chat know why a patient would have a fatty liver? Fatty liver just means, just like when you are an obese person and you have adipose tissue everywhere else, you also can have adipose tissue on your liver. If you have adipose tissue on your liver, that's called a fatty liver, and that will keep your body from detoxing the way it's supposed to be detoxed, okay? So one thing about semaglutide and tirzepatide, y'all, it cures fatty livers. I had someone tell me before that they wish their parent was alive when this medication came on the market, so that they can be cured of fatty liver disease. All right. So that's what your semaglutide does. Your tirzepatide, that's your Beyonce and your Kelly of GLP-1s. That's your MOUNJARO, and that's your Zepbound. MOUNJARO is usually dosed for patients who have diabetes. Zepbound is usually dosed for patients who have who are obese, right? So tirzepatide is your most potent LB down. It gives the most potent LBs down. Y'all know I'm talking in code, right? So please read between the lines, all right? That's available. It has a dual incretin action, meaning you have GLP-1 and you have GIP. Your GLP-1 is going to do the exact same thing that semaglutide does. It's going to delay your gastric emptying. It's going to help you with food consumption control. It's also going to help you, it's going to signal to your brain when you are full. It's going to keep you full fast. And it's going to make you full fast. It's going to keep you feeling full for a very long time. Now, when you add GIP to that, your GIP is your fat burner. So you have GLP-1 and you have GIP. Those are two satiation hormones that are produced in your gut that signals to your brain when to stop eating. Okay, so that's what those are. All right. So what are the common side effects of all of these? Your liraglutides, your dulaglutides, your semaglutide, and your tirzepatide. What are the common side effects? Y'all drop it in the chat for me. Who knows? Common side effects. Y'all know this. I teach this to y'all all the time. For the 131 people who are in the chat, if you're not yet following me, click this picture. Make sure you're following me. Turn your notification bells on so you know when I am live. Hey, Miss Lois. Hey, Kelly. Thank you for the follow, baby. If you are new to this platform, you guys, you know that my name is KEASHA DIXON. You guys, I work under the umbrella of emergency room medicine, outpatient medicine. I'm the charge nurse of a 20-bed outpatient unit. I am a patient and a partner of Amble Health. So this is a Amble sponsored live. If you want to start your GLP-1 journey and you want to be under the umbrella of a clinician, click this picture twice. It'll bring you to my profile page and you will look for the LINK, and that's how you get started. Okay. Thank you. So someone says nausea. Absolutely, Charlotte. Somebody said constipation. What else? Y'all know this. Sable, no, not gastroparesis. Gastroparesis happens in patients who have long-term uncontrolled diagnoses where it harms the nerves that feeds the stomach, like diabetes. If you have uncontrolled diabetes, those high glucose levels will cause nerve damage in your stomach, which causes gastroparesis. GLP-1 MEDs do not cause gastroparesis, baby. It doesn't. It will delay your gastric emptying and cause you to feel full faster and longer, but it does not cause gastroparesis, boo. Gastroparesis is paralytic stomach. What does paralytic mean? Paralyzed. What does paralyzed mean? No movement. When you have a paralytic gut, you can't swallow your spit. You have to have an NG tube where we have to feed you through it. And some patients get gastrointestinal tubes where you get fed through your gastrointestinal tube. That's gastroparesis. GLP-1s do not cause you to have that, baby, but it will delay gastric emptying. There's the difference. Somebody said sulfur burps. Yes. Headaches. Yes. But more specifically, dehydration headaches. How do you treat a dehydration headache? You drink water and you drink electrolytes. How do you control nausea? You make sure you're not eating highly dense proteins, highly sweet foods, highly fat foods, fried foods, anything that's going to cause you to have a lot of gastric production. You cannot. All right. Another thing that treats nausea, just being like least invasive, you can do ginger chews, peppermint, you can do peppermint oil, you can waft your nose with alcohol swab, not sniffing alcohol. Wafting means like this is to waft. All right, that can help. Again, ginger chews, peppermint. You can ask your clinicians for Zofran. Zofran is the first line prescriptive med that your doctor will order to help with nausea. Your doctor can order Reglan. You can get on a protein pump inhibitor that's like Pepcid, Zantac, Protonix, Prilosec, right? For the 190 people who are in the chat, if you're not yet following me, click this picture. Make sure you're following me. Turn your notification bells on so you know when I am live.
It's great.
Thank you, baby. So we're doing education on GLP-1s, which are your dulaglutides, your liraglutides, your semaglutides, and your tirzepatide. When y'all see me on, I'm going to give you all the education that you need, because education empowers you, and I need you guys to know the difference. So your liraglutide, for those of you who are taking liraglutides, that's your Saxenda, your Victoza. Those are injectables that are once a day. Your dulaglutide, that's your Trulicity. Your semaglutide, that may be Ozempic or Wegovy. Your tirzepatide, that's Zepbound and Mounjaro. Okay. So Sable 31 says pharmacists, they do cause gastroparesis. You're a pharmacist. You're not a clinician. It does not. You need to do more education. It does not. Please don't let me get into it, honey, because I've been a nurse for 24 years. And I've been taking these meds for 3 years. I know you're a pharmacist and you know what it is that you're doing, but gastroparesis happens because of uncontrolled diagnosis. GLP-1s will cause delay in gastric emptying, but it will not cause it does not cause nerve damage in your stomach. You know better than that.
Let them know the method of action matters more.
You know better than that. Delayed gastric emptying, yes. That's fine, Miss Sable or Mr. Sable. But you know it does not cause gastroparesis. If it causes gastroparesis, tell me the percent of patients that get gastroparesis with GLP-1s. As a matter of fact, I'll tell you. Give me 1 second. Hold on, y'all. I love conversations like this. What is the percentage of a patient who will develop gastroparesis from taking a GLP-1 medication according to clinical evidence? Because we talk about evidence-based practice. We don't talk about what you think personally. We talk about clinical evidence. 1 second, y'all. Hold on, y'all. I need a number. So with absolute incidence, one source mentions about 0.1% of patients prescribed GLP-1s were diagnosed with gastroparesis. So what are you talking about? 0.1%. Gastroparesis is caused from uncontrolled health issues. You're a prescriber. I'm a treater. I treat. We're two totally different professions. You prescribe, I treat. Okay? 0.1% is not enough to even talk about with gastroparesis. And in that 0.1%, they have some type of diagnosis that has caused them, some type of uncontrolled diagnosis that have caused them to have nerve damage. GLP-1 medications do not cause nerve damage. They help your heart. They help your kidneys. They help your lungs. They help autoimmune diseases. So you got to come back. You in the wrong line, friend. I promise you. You're in the wrong line. Somebody said 2%. That's not even enough to even be talking about. And in that 2%, those 2% are not obesity patients. Those are patients who have diabetes, who have some type of autoimmune disease that affects their nerve, because gastroparesis is a nerve damage. I did not say that GLP-1s do not cause delayed gastric emptying. Delayed gastric emptying is not gastroparesis. It's delayed gastric emptying. Okay? I put paralytic stomach and delayed gastric emptying is two totally different things. So you got to circle back after you do a little bit more education, pharmacist. Don't get me started, friend. So your 37 years, I'm not sure what's going on with them 37 years, friend. Okay? So since we're talking about it, what is gastroparesis? Hold on. What is gastroparesis and how does it develop in patients who are obese without complications of comorbidities? Hold on, y'all. I love it. I love this type of stuff. Okay, so let me read this to you guys. Thank you, Sugar. She says, take your time. And y'all, I'm using ChatGPT just because, you know, I'm not even using a what do you call it? I'm just going to use ChatGPT just because it's easier. I want to read this to y'all. Okay, so what is gastroparesis? Gastroparesis is a condition in which the stomach empties food into the small intestines, which moves slowly than normal, even though there is no physical blockage. This delay occurs because of the vagus nerve, which controls the stomach muscles or the stomach smooth muscle itself. It's not functioning properly. As a result, digestion slows or stops. Okay. How does so I asked, how does it develop in patients with obesity without other comorbidities? Because that's important. That's important. So if you're an obese person and you develop gastroparesis, how? Why does that happen? Number one, automatic nerve system dysfunction. It don't just happen. It's something got to be wrong. Okay. So number one, it says autonomic nerve system dysfunction. Excess adipose tissue can trigger low-grade inflammation. So something has to happen. So it says systemic inflammation can cause gastroparesis. That's a problem. That's a disease process. And did I not say gastroparesis happens because something is there making it happen? It's something that's not being controlled. It's something wrong that is causing gastroparesis. It just does not happen. Okay. Number 2, hormonal or metabolic influence. So you may have a hormone issue. You may have a metabolic issue. Is my pharmacist still in here? Because you need this lesson. All right. Obesity alters hormones like your leptin, your ghrelin, and insulin, also of which help to regulate gastric emptying. Okay. These imbalances. So here's the problem. These imbalances can cause delayed gastric contractions and your sense of early fullness. That's a problem. We ain't even mentioned GLP-1s yet. It don't just happen, y'all. There's something wrong that causes gastroparesis. I've been doing this too many years to know. Okay? All right. Increased abdominal pressure. Okay, so extra abdominal fat, because we're talking about how does gastroparesis happen in an obese person who does not have no comorbidities. You don't have no diabetes. You don't have heart disease. You don't have autoimmune disease. I'm telling you, if you just a healthy person that's obese, that's big, this is how you can get gastroparesis. We ain't even talking about GLP-1s, all right? Because mind you, if you have these issues, if you're an obese person and you're having these issues that can cause you to have gastroparesis, if you take a GLP-1, it's going to correct your hormone. It's going to correct your insulin sensitive. It's going to make you more insulin sensitive. It's going to decrease that belly fat so that you will stop having these issues. And then now you will be healthy. So some people need to stay in their lane. You didn't have the same education I had. Okay? All right. Here we go. So increased abdominal pressure. Hey, PJ. Extra abdominal fat mechanically increases pressure on your stomach, slowing the forward movement of contents. That's a problem. Okay? All right. Medication-related factors. Okay? Opioids, that's like pain medicines. Anticholinergics that directly slow gastric emptying or mimic or worsen gastroparesis. So this is one of the, and I'm going to put GLP-1s in there. This is why when your doctors do their consultation, so I tell y'all have to tell them everything. If you have a problem with gastroparesis, your doctor is not going to give you GLP-1s. Why? Can somebody tell me why? I just need one person to tell me why. Why? If you have diabetes and you have issues already with delayed gastric emptying, why will your doctor not give you a GLP-1? Come on, Bubbles. Pin. You gotta listen. You gotta wake up early in the morning to get over on this chat, because the people that's in my chat, they already know what's up. My chat is very educated. You can't come in here saying anything, because we always educating in here. Thank you, Texas Trish. Thank you, Gigi. This is why if you are diabetic, if you are pre-diabetic, if you have an autoimmune disease, on that medical questionnaire, they will specifically ask you, do you have gastroparesis? Do you have issues with digestion? Because if you do, there is not one doctor that is going to prescribe you a GLP-1 medication, because the mechanism of action for a GLP-1 medication is to delay your gastric emptying. You think they're going to give you a medicine that's going to make it worse? No, because GLP-1 medications already delay gastric emptying, but it does not cause nerve damage. If you have nerve damage, you got something else going on. Uncontrolled diabetes. some type of autoimmune, something that is causing the nerves in your belly. Let's see. Let me see. Hold on. So let's see. What are some medical diagnoses that, if they are uncontrolled, can cause gastroparesis? Diabetes is number one. Hyperglycemia damages the vagus nerve and enteric system, leading to autonomic neuropathy and delayed gastric emptying. Okay? Uncontrolled diabetes. Now listen, this ChatGPT. I already told y'all what it was, but this is just to confirm. Okay? Autoimmune diseases. Scleroderma can cause it. Lupus can cause you to have gastroparesis. Parkinson's can cause you to have gastroparesis. Multiple sclerosis. Some strokes can cause you to have gastroparesis. Hypothyroidism can cause you to have gastroparesis. Chronic kidney disease can cause you to have gastroparesis. Uremia can cause you to have gastroparesis. Some post-surgical abdominal surgeries can cause you to have gastroparesis. Infections, some viral infections can cause you to have gastroparesis. Okay? The percentage of a patient that's taking GLP-1s, the 0.1 and 2%, they ain't even nothing to even talk about. Okay, so don't come on here trying to scare people and make people think that they're in this percentile of patients, if they take GLP-1 medications, they're going to get gastroparesis. The devil is a lie. Stop it. You run more risk taking a blood pressure medicine of being harmed than taking a GLP-1. Don't get me started. A blood thinner. I can promise you, patients take way more medicines that can cause them harm than a GLP-1. Pharmacist. Girl. Nebulizer says, warfarin, thank you. Do you know how many people I take care of that is on a blood thinner that fall? And they come and we got to give blood transfusions because they done bled to damn, almost damn to death. Do you know how many people that take blood pressure medicines that bottoms out their pulses, that bottoms out their blood pressures, that we got to give boluses to because they're bradycardic? I don't get GLP-1 medicines through the ER. I mean, patients with GLP, if they come in there, it's because they nauseated or constipated. Not because they have gastroparesis. So get out of here with that. The treatments that patients come in through the ER that are taking GLP-1s, they're quick fixes. We fix some people and they go home the same night. If they dehydrated, we give them Plasmolite. That's electrolytes through their IV and send them home. Easy. If they're constipated, we give them a stool softener, a laxative, an enema. They have a bowel movement with us. We send those people home. I've been on GLP-1s for 3 years. I've never gotten anybody in the emergency room that's on a GLP-1 with gastroparesis at all. Vomiting, yes. Constipation, yes. Gastroenteritis, yes. Sulfur burping, yes. But we know that already. Hi, how are you? FYP, I have hypothyroidism and I had a hysterectomy in 2017. Now I have gastroparesis. And your gastroparesis can very well be secondary to your hypothyroidism or your hysterectomy, because you had hypothyroidism can cause gastroparesis, and abdominal surgeries can cause you to have gastroparesis. But you talk more with your clinician, and your clinician will let you know whether or not you benefit from taking a GLP-1. But don't let people sell you that GLP-1s will cause you to have gastroparesis and just leave it blatant like that. You're going to have to explain that to me. If clinical studies prove that only 0.1 to 2% of people can get gastroparesis with GLP-1s, give me my damn medicine. Give me my medicine. What are you talking to me about the 0.1% and 2%? That is nothing in medicine. Nothing. That's fear-mongering at best. You came in the wrong line, boo. I'm very educated. Trust me, very. Listen, I have doctor. Let me tell you something. I was telling this to Kima the other night, y'all. Kima was on the phone with me while I was at work, and they had a doctor asking me questions, and she was like, "Why he asking you?" And I'm telling her, "Girl, because that's what they do." Are there any nurses in the chat? Please, are there any nurses in the chat? Not saying that our doctors, because our doctors are very educated, but our doctors lean heavily on us for education. Because we're with the patient. We see the side effects. We treat the side effects. Come on, Tara. When I call my doctor because I want something for my patient, I don't say, "Oh, my patient is nauseated. Can you order something?" That's not how I talk to my doctors. I say, "My patient is nauseated. I need you to order me some Zofran. I know what I want. I need you to get Zofran ain't working. They need Reglan." That's how I've been in this almost 24 years. I know what they need. I just need you to write it for me. If they have any nurses in the chat, please confirm this. This is how we talk to our doctors. They will come and say, "What is it that y'all use for this? What is it that words that you see?" Because they don't want to be called. They don't want us calling them all night. They want to know what's gonna work, what you need, and we tell them. Come on, Miss Debbie, let the chat know. This is how we talk to our doctors. They rely heavily on us. Ms. DeLion says, "Yep, I've been doing it for 30 years, and you're exactly right." Please let the chat know. When y'all go into those hospitals and y'all see y'all nurses, y'all better let y'all nurses know what's up, because we're the ones that get y'all what y'all need. Because a lot of times y'all doctors be too busy to even be concerned. Not to say to be concerned, but they're not going to assess you like we're going to assess you. We're listening to your breath sounds. We're listening to your bellies. We're seeing where your swelling is coming, where your swelling is at. Okay? We're taking your vital signs. We're watching you, the monitor. We're reading your EKG strips. Please do not get me started. Mama Jen says, "I'm sitting here with my mom, NP for 35 years, and she agrees with everything that you're saying." It's the truth. And that's it's a heavy burden to bear. Because sometimes I be at work and I'm like, I just wish he would come to I just wish they would come to the bedside and see this patient, but they rely heavily. They're not going to get up and come see you. They are relying on what my eyes see, what my evidence-based studies have shown, what my clinical experience have taught me. They're relying on my assessment for their orders, my ability to critically think and paint a verbal picture for them to give them orders. So I promise y'all, when I'm on here and I'm educating, I'm not educating from a place of what I think. I'm educating from a place of what I know. Okay? Tara says the greatest burden reward. Right. Okay? So do not let a person fearmonger you and make you think that you taking a GLP-1 medication is going to cause you to have gastroparesis. There is a 0.1 to 2% rate that a person who is healthy will get gastroparesis. If you're a person that takes a GLP-1 medication and a couple months later you have gastroparesis, you had something going on with you already. Whether you disclose that to your doctors, because we do have some people that do that. So there's a small amount of people in the GLP-1 community who wants to lose weight so bad, they will hide problems. Okay? From their doctors and end up having issues. Which is why I tell you guys all the time, yes, you want to be the most healthiest version of yourself, but you want to be here. You don't want to cause yourself to have problems in the long term just because you're not being honest with your doctor. Y'all, that happens all the time. People want things. They're so desperate for things. They hide stuff. Hold on. Let me see what this person is saying. Let's see. Honey, I only talk about you when I'm telling people who I follow. Oh, thank you, sugar. Melinda says long-term issues at that. Right. Right. And I'm guilty. I'm not going to say, oh, whoever I sent that invitation to, I didn't mean to, friend. I'm guilty of that. I'm not even finna get on here and act like I haven't done, went and did a telemedicine and requested some things that I wanted. And they asked me, do you have a medical history? I say no. I do. I have a medical history, but sometimes I be wanting what I want. And, you know, and I'm just being honest with you guys. I use telemedicine too. And it's something you don't need to know how many surgeries if I got a urinary tract infection and I just want you to order, and this is me. This is just a personal, this is just me letting telling my business. If I have a urinary tract infection and I don't want to go to my doctor's office, I'm going to log online, me personally. I'm going to log online and all those medical questions that they're asking me, do you have this? Do you have that? Have you had any surgeries? No. You don't need to know all of that. Just give me my Cipro. I got a bladder infection. You know? There's GLP-1s or whatever. And right now, we real desperate in the GLP-1 community because insurance aren't paying. There's a lot of people hiding their comorbidities because they want GLP-1 medications. Okay? Just give me my medicine. You don't need to know how many surgeries I had. You don't need to know what my comorbidities are because you're going to deny me. It happens every day. I'm a whole nurse. They have patients. Y'all know how to tell y'all. People be coming in and they be, you know, messing with the PEPs, the PEPSs and all of that. They be giving themselves and they come in with all of those infections and they think we don't know. We know. And because the patients come in and they be having injection site reactions and they don't tell us, oh, we're doing PEPs and PEPSs or whatever it is that they're out there doing. What y'all think we think they're doing? If you don't tell me, if I see you coming in, right, and I see you have an injection site reaction back here, or I see you have an injection site reaction, some cellulitis right here, and I can look at it and assess how aggressive it is, and I can look at it and assess that it comes from an injection. Y'all think we don't know? We do know. But if you don't tell me, oh, it's because I'm giving myself PEPSs, y'all, we're going to think polysubstance. Why would you want us to think that? Now we're drug testing you and everything because we don't know what's going on. So we got to make sure first, you ain't doing DRUGSs out here in these streets. You understand? Just say I'm doing PEPSs and now I have an injection site reaction so that we can take care of you and get on and you can go on about your business and we can go on and take care of people who are critically ill. Because a cellulitis infection is really not that bad unless you just waited to come to the emergency room and now it's so bad it's systemic. But a lot of times it's so painful, you know, it brings you right to emergency, you know. I don't want to say, y'all let them know what I'm talking about in the chat, the PEPSs. But a lot of people mess with that. Y'all let them know in the chat. Thank you, Tara. So a lot of people be doing that and yet they come through the emergency room and they have all of these injection site reactions and they think that we don't know. We know. We know y'all been trying to reconstitute stuff at home and it didn't work and the active you done messed up your active. Now you have an injection site reaction. But because you don't tell us, we automatically think it's polysubstance. We think you out here shooting up all kind of stuff because we don't have no choice. You know, you ain't saying what it is. We know it's an injection site reaction. So now we got to drug test you to make sure that we're treating you or not giving you something that's going to kind of affect something that you may have done in the streets. Not everybody, you know, all the care providers, the doctors, the nurses, the care team, everybody that's taking care of you looking at you crazy. And all you really did was take a PEPS. Just say it. But here we go again. Like I said, people don't come through the ER. People don't come through the hospitals, and they don't really be telling people their business like that, which is okay if you don't want to, but we still have to treat accordingly. You know what I'm saying? I don't even know how I got on that, but I'm just saying, y'all just be mindful of the information that y'all get out here in these streets. Be mindful of who on the screen, who's talking to you guys about certain things, and make sure people are truly educating you and telling you what the benefits are. If you're asking a question, ask the whole question. What is the benefit of what I'm taking, and what is the contraindications? Okay, I'm gonna tell y'all everything, the good and the bad, because for every good thing that you take, there is some type of contraindication. No matter what it is that you're taking, there's a contraindication. All right. But the whole reason why we're on this is because there's a pharmacist came into the chat and said that people get gastroparesis from taking a GLP-1. GLP-1s will not cause you to have gastroparesis. There's a 0.1 to 2% chance of that in a healthy person, which is nothing. What, baby?
You want a bowl of this?
I'm gonna fix my own food. Ask Daddy if he want to eat.
He do want to eat.
He's ready to eat right now?
He was asking. I don't know about right now. I don't know.
Okay. So for the 185 people who are in the chat, if you're new here, click this picture. Make sure you're following me and turn your notification bells on so you know when I'm live. This is an Amble sponsored live. So if you are someone who wants to start your GLP-1 journey, and you want to be under the umbrella of a clinician, all you have to do is come to my profile page on TikTok and look for the LINK, and you'll have everything you need. Somebody says ignorance is bliss. It is. And you know what, Tara? In my community, like my followers, I pride myself on my followers being able to defend themselves when someone is attacking them for taking a GLP-1 medicine. Because it's so easy for someone to fearmonger you and say, why are you taking that? That's going to cause you to have this. Oh, you're going to be sick all the time. Oh, you're going to be constipated. Oh, that's going to lock you up. You're going to have gas. You know, it's so easy for somebody to do that. I pride myself on my followers being like, no, it's not. This is what's going to happen. It's going to do this. It's going to do that. And I mean, you going to bat. Educate them in the most disrespectful way. You know, I want you guys to put them in their damn place. Stop it. Stop trying to tell these people that this medicine will hurt them when it's going to help them. It will help their metabolic. It changes you metabolically. It makes you more insulin sensitive. It controls your A1C levels. Patients who are pre-diabetic, it prevents you from being diabetic. Being diabetic is not nothing to play with. You know, diabetes causes kidney disease. It causes you to have poor wound healing. Diabetics, when they get a cold, they get a cold. When they get sick, they get sick. They don't heal like we heal. You know, so if you can prevent someone from becoming a diabetic, why not? The benefit outweighs the risk in these medications. Why is people not talking about that? Your benefit of taking a GLP-1 outweighs your risk of 1 to 2% gastroparesis. Let's call a thing a thing. What do you think about GLP-1s and type 1? You know what? If I'm being honest, Ashley, I need to do more education on that. Let me take a picture of that. I honestly do, Ashley, because I very rarely have a person. I need to do more education. I need to get into my medical journals on that. And I need to talk to an endocrinologist about that, just so that I can get more education on it, friend. But that's an amazing question. I don't have enough education for type 1 diabetics. Those are insulin dependent diabetic patients who have to take insulin. Their body does not produce insulin. Those are type 1 diabetics, y'all. So honestly, I really honestly need to do more education on type 1 diabetics with GLP-1. I don't have enough education on that. I've not done any studies on that, honestly, if I'm being honest. He was very confident in suggesting it, stating the low risk. Okay, thank you. I'm type 1 and struggling. I'm insulin resistance and can't lose weight despite my active. So Ashley, do you not have an endocrinologist? You're type 1, so you have an endocrinologist. So I would definitely go to my endocrinologist and ask them. And Ashley, girl, you know, you can create, you can use your platform to educate patients who have type 1 diabetes and who want to take GLP-1s, girl. You can use your platform and you can be like the poster child for, you know, I'm probably not using that word right, but you can be the person that we all go to for that type of education because you're type 1. Let me follow Ashley just in case Ashley start doing that. Girl, because you could educate me. And I'm a whole nurse. I could learn. Let me tell you something. Every time I'm live, I learn from my chat. Somebody teaching me something. I know a lot of stuff, but I don't know everything. But you ain't gonna challenge me on what I know. Because you know what? Because I'm always gonna say, what are the statistics? What does evidence-based studies say? Because that's what I'm gonna believe. And the pharmacist that was in here could not say, like, don't come in here saying what you think without giving us the facts. Give me the facts. I can receive it from you if you give me the facts. Give me the clinical studies and let me know what medical journal you use or whatever so that I can go back and read it myself. I'm not going to take your word for it because not every, you know, I know, listen, don't get me started. Pharmacists lose their licenses every day. Nurses lose their licenses every day. Doctors lose their licenses every day. You can't just talk to me. I work with y'all. I see you practice. I see how you practice. We have some really good nurses. We have some really bad nurses. We have some really good pharmacists. We have some really bad pharmacists. We have some really good doctors. And we have some doctors that ain't shit. And that's a fact. They're human beings just like all of us. Okay? They do stuff just like regular humans. Okay? They be doing shit that they don't have no business in the streets when it comes to pharmaceuticals, just like any other humans. Let me tell you, we get, as nurses and people in medicine, we get journals or letters that have all the shit nurses do in their offense. They steal medicines, they abuse medicines, doctors too, pharmacists too. So you can't come tell me that. You can't come tell me stuff like that. You may be able to get away with that with people who don't work in medicine, but for a person that's in medicine, you know you got to come with the facts. Cuz y'all are not perfect. Y'all are not God. Y'all just have a degree that you went to school, you went and got a degree. But it doesn't mean that you know everything. It doesn't mean that your word is bond. You know what I'm saying? And when I don't know something, I don't have a problem saying I don't know. Tell me, teach me. I tell y'all I don't know all the time. I tell y'all, well, let me use Chat GPT all the time. If I don't know, I don't know. Pharmacist got made because I counted my pool at the counter and was short too. Come on now. Kendall, you know, you work in the hospital. They're not perfect people. As a patient, you know how many, because I'm a cancer survivor. As a patient, you know how many doctors I fired? That have come in my room and have said something that I'm like, if you don't know this, if you're asking the nurse this question in my presence, give me another doctor. Not that one. I'm on MOUNJARO, 26 months in. I'm 93 pounds down, A1C. I got diagnosed with stage 3 thyroid. Oh, you got diagnosed with 3 thyroid nodules. What are your thoughts? Mama D, my thoughts is that you definitely need to go to your endocrinologist and ask them whether or not you can continue taking your MJ. Now, I think that you can take your MJ, me personally, because, you know, MJ is it is contraindicated in patients who have MTC, which is medullary thyroid cancer. And you having a thyroid nodule is not the same. But also, I'm not too versed on how thyroid nodules affect your MJ. So I would just say, knowing that you have thyroid nodules, I would make sure my doctor my endocrinologist knows that I'm taking MJ. And I'm only saying that because a lot of times you can have a primary care doctor and a specialist, and your primary care will order something that your specialist don't even know you're taking. So that's why your care team, everybody needs to know who's prescribing what. Because that's another thing people do in medicine. Oh, my primary care doctor, when order, they say no, I'm gonna ask my endocrinologist. And when you go back to your primary care, they say, what's new medicine you're taking? And you don't tell them. Let me tell you, I done seen it all. Sunshine says, my A1C level is pre-diabetic. I have irritable bowel syndrome with daily abdominal bloating. Can I take a GLP-1? So I have heard a lot of patients with irritable bowel say that when they take GLP-1, that it helps them. As a matter of fact, my nurse practitioner, Aaron Sahale, y'all remember Aaron? Aaron has irritable bowel syndrome, and he says his GLP-1, he has less exacerbations. He has less inflammations, less what do you call it? What do you call it when you get irritable bowel syndrome episode? Less help me, friend. What do you call it? You have flare-ups. Yes, he has less flares on GLP-1s. Now, can you take it? Again, that's a doctor question. I'm the nurse. So once your doctor prescribes to you what he wants you to have, then come back and I will educate you on what he's prescribed. But as far as me telling you, is it safe? That's a clinician question, baby. Celiac disease with GLP-1 has helped with inflammation. You see, friends? So there are a lot of people who have like irritable bowels, Crohn's disease, celiac disease that take GLP-1s, and they said they have less flare-ups. But every patient is different. You understand? Every patient metabolizes different. Every patient has different comorbidities. Every patient is on different medications. So it's different for everybody. So that's why you're never supposed to compare your disease process or your comorbidities, your medications to other people. You always have to stay in your own lane and connect with your clinicians so that your clinicians can educate you, friend. All right, it's good to ask questions, but just make sure you're asking the right question to the right person. Okay, and so when you're asking about whether or not you should take a medicine, that's really not an appropriate question to ask a nurse. That's for a clinician, because nurses don't prescribe. Respectfully, you understand what I'm saying? Now, once you go to your doctor and they say, okay, well, you can take GLP-1s for this. Now I can tell you what is the benefit of you taking a GLP-1 as a patient with irritable bowel. You understand what I'm saying, friend? I stay in my lane. You know what I'm saying? So I try not to overstep my bounds. Tara says, understand that GLP-1s can improve inflammation. Thank you, friend. Let me go to ChatGPT and I'm going to tell you how. We're going to use ChatGPT and we're going to ask the question, how does GLP-1 medications help the inflammatory process with non-specific comorbidities? We don't really have to be specific. Skelly says it helps with overall inflammation. Yes, it does. I'm looking at the chat while ChatGPT, y'all, ChatGPT going to town. What do I think about the GLP-1 drops? I'm not familiar with them, baby. Tara says your continuity of care is so important. Preach, friend. Y'all, Duchess of TikTok says she found my page in December and she's now 40 pounds down. Congratulations. Congratulations, baby. Sunshine says my A1C level is pre-diabetic. She says I have irritable bowel. Okay. She said, okay, I had read that. Okay. All right. Okay, so let's talk about it. Let's talk about the inflammatory process with GLP-1s. And this is ChatGPT, y'all. Do y'all trust ChatGPT? Do y'all trust me using ChatGPT just for this question? No, it's not a medical journal, but ChatGPT be giving us some good little information. Let's see what it says. Oh God, did it get really in depth? Hold on, you guys. Okay. How does taking a GLP-1 medication help the inflammatory process in non-specific comorbidities? Just a generalized answer as far as inflammatory process and GLP-1 meds. Okay, I'll say yes. Okay. So it says, here's a generalized overview of how they help with inflammatory process. Okay, it says GLP-1 receptor activation decreases your pro-inflammatory cytokines. Okay, and I'm not going to get into, there are certain things that are called inflammation markers in medicine, and they're called CRPs. Okay, those are your inflammation markers, which lets your doctors know how inflamed you are, right? Okay, so it says number one, it reduces systemic inflammation. Okay, so it reduces inflammation systemically. As a result, it lowers your baseline inflammation in your tissues, in your blood vessels, and in your fat cells. Number two, it says it improves your insulin sensitivity. Chronic inflammation and insulin resistance feed each other. GLP-1 medications improve your insulin signaling and glucose control, which in turn reduces the inflammatory stress response that caused by excessive glucose or fat accumulation. Did y'all get that? Let me read that again because that's good. Chronic inflammation and insulin resistance feed each other. So GLP-1 medications improve your insulin signaling and glucose control, which in turn reduces inflammatory stress response caused by excess glucose or fat accumulation. That's good. That's real good. I like that. Number three, it says protection of endothelial and vascular tissue. By lowering oxidative stress and improving your nitric oxide availability, GLP-1s help protect endothelium. Endothelium. Does anybody know what that is? Probably not. Well, I'm not going to say probably not. I'm going to tell you what it is. Your endothelium, oh God, I can't even say it. Your endothelium is the inner lining of your blood vessels. Okay. Tanya says it would have to, because inflammation is the cause of most of these diseases. Right, Tanya. Right. Okay. So again, your GLP-1 protects your endothelial and vascular tissue. Okay. So as a result, it reduces vascular inflammation and it lowers your risk of cardiovascular complications. Thank you, Tara. The endothelium, well, I can't say that. The endothelium is the inner lining of your blood vessels. So it reduces vascular inflammation and lowers your risk of cardiovascular problems, right? Number four, it helps your immune response. GLP-1s, y'all. Thank you, Tara. Let me pin that. I'm so glad I got a nurse in the chat helping me. Oh my God. Thank you, baby. I'm so appreciative of you tonight. I promise. So it helps, GLP-1s help your immune response. So ChatGPT says your GLP-1 receptors are found on your immune cells, such as your macrophages. Okay. Those are immune cells, right? When activated, they promote a shift of M1, which is pro-inflammatory, to M2, which is anti-inflammatory, which reduces tissue injury and chronic inflammation. So let me just say that in layman's terms. When you take a GLP-1 medication, it calms down tissue inflammation. All right. So that's basically what we're talking about. We're talking about GLP-1s as a whole, friend. Thank you. Who said that? Let me pin that. Yes. Bring us back. Girl, you better bring us back to microbiology. For the 170 people who are in the chat, if you're not yet following me, click this picture. Make sure you're following me. Turn your notification bells on so you know when I'm live. For those of you who are meeting me for the very first time, my name is KEASHA DiXON. You guys, I am a registered nurse. I work under the umbrella of emergency room medicine. Y'all, I'm a charge nurse of a 20-bed outpatient unit. So I do both. I'm also a patient and a partner of Amble Health. You guys, this is an Amble sponsored live. We're just talking about all things GLP-1s and how you benefit from GLP-1s. And we're just going a little bit in depth with education just so that you guys are empowered by your knowledge of GLP-1s. And right now we're talking about how GLP-1s help your inflammatory responses, how it helps to calm down inflammation in your body. All right. Another thing that GLP-1s will do is they are neuroprotective, gut-brain anti-inflammatory effects. So GLP-1 medication reduce your neuroinflammation and improve your gut barrier integrity. So it reduces leaky gut. So for those of you who are talking about like irritable bowel and stuff like that, I think this leans on you all a little bit, which helps decrease inflammatory molecules entering your circulation from the gut microbiome. So it helps your gut microbiome. Okay. In short, so there's an in short. Thank you, Tara. Ooh, let me pin that. Boom. Thank you, baby doll. So in short, and this is ChatGPT again, y'all. This is ChatGPT that we're using. GLP-1 medications help calm the body's inflammatory environment by lowering your inflammatory cytokines. It improves your insulin resistance. It protects your blood vessels and your gut, and it regulates your immune cell activity. Yes, holistic mama. Boom. Yes. So it says, would you like me to simplify this into a nurse educator style explanation? Let's say yes. For those of us who need just a little bit more. Are y'all good? Are y'all good? Y'all want to move on? Are we all on the same page for the 150 people who are on the live? We're gonna go because it's midnight. Y'all are good. Okay. So listen, the whole point of my lives, y'all, is to empower you to make sure you're very knowledgeable of your GLP-1 medication. So you don't have no Tom, Dick, or Sally, or however, coming telling you that you taking a GLP-1 medication is more harmful than good for you, because the devil is a lie. It's just so not true, y'all. And if someone starts talking to you about how these medicines harm you, ask them, where did they get their information? What medical journal did they get this from? And ask them for it. Like, give it to me so I can read it, because you can learn. You know what I'm saying? We all can learn stuff from people. I'm never against learning anything. You just got to show me. If you can show me and I can learn from it, and I can learn from it, please. Because I never want to be the girl in the room that don't know shit or feel like I'm missing something. I want to know everything. Give me the clinical studies. Give me the medical journals where a clinician has written this or a pharmacist has written this and they're showing statistics. I need numbers. Okay, information should be cited or, ooh, Tara, you tearing them up tonight. I love it. Oh, girl. Tara, where's her comment? Let me pin this. Baby, you tearing them up tonight. And because it's all facts. All facts. Oh, she said I'm fresh. She said I'm fresh off work. I hear you, friend. I hear you, friend. Girl, you need to be doing lives. You need to be doing lives, friend. You got to help me in this community, because I promise you, our people are not getting this education that they need, because we got to shut these people down that be coming around trying to make us feel like we doing something to hurt ourselves. When I tell you, girl, I'm in the best health of my whole, I'm 48 years old. I'm in the best health of my whole entire life. My numbers have never looked so good. My body has never felt so good. My brain, my mind, the way I think, the way I prioritize, the way I plan things, the way I troubleshoot. Girl, I'm on it. I'm so sharp right now. I'm so sharp right now. You know, and I tell people all the time when it comes to your GLP-1s should be making you have a better quality of life and longevity. Okay, your numbers, your labs should be looking good. Your body should be moving a little bit more better. Your mind should be thinking better. You should have a better relationship with food. And your whole experience, the way you walk and talk, the way you move in your health journey, it should be inspiring your family. You understand? Because it's not just you that should be benefiting. Your family should be looking at you and should be thinking, damn, well, what Keisha and Wendell doing over there? You know, because Keisha lost 97 pounds. My husband, his name is Wendell. My husband lost 75 pounds. My daughter lost 45 pounds. We do this as a family. You know, my followers, y'all, let's do this. Y'all drop, if you're on a GLP-1 medicine, drop in the chat right now where you're at right now. I'm 97 pounds. Just put the number. How many pounds are you down? He was, okay. Put how many pounds you're down. Y'all, Latina says 101. Mama D, 93. Miss Deb, hold on. Miss Deb, 80. Tracy, 45. Nebulizer, 80. Bubbles, 22. LaQuasha, 70. Joni, 62. Yorkies, 108. Miss Lois, 76. Pumpkin, 122. Anita, 23. iRock, 46. Drea, 114. Pepper, 20. Kendall, 57. Miss Neva, 86. Miss and we're gonna end the live on this. Mel Simpson, 35. Stephanie, 104. Allison, 14. Tessa, 91. Cassie, 20. Tara, she says she's on MJ. She is 5 months in, 55. Y'all, I am Rachel, 116. Miss Mary Ann, 105. Come on now. This is statistics. Yo Adrian, 25. It don't get no better than that. And counting. And counting. We're not even done. Look, the Lion says, and I bet none of them have had gastroparesis. Come on now. Don't come in here saying anything, because me and this chat, we gonna get you all the way together. And I bet y'all's labs look good. I know y'all are sleeping better. I know y'all are, I know y'all just living y'all best lives. I know y'all are living y'all's best lives. And somebody said, that's just the scale. Let me pin that. Come on, Miss Lois. That's just the scale. Girl, I throw that in my soul, Miss Lois. Hey, friend. Y'all, Anita Harris says, congratulations to everybody. Oh, look, Pumpkin says, I'm off the CPAP. Okay, so let's drop some 9-scale victories in the chat. A1C level normal. My inflammation is non-existent. Yes, my 9-scale victory is where I used to have a rheumatoid arthritic flare at least once a month. It's been 3 years and I may have had 5. That may have lasted 2 days. At most 3. I used to stay in pain. Girl, I'm down in weight and I haven't seen since I was 40 years old and I'm 55. Y'all, that was Miss Trisha, another nurse in the chat. Pumpkin says her BMI was 52. Now it's Pumpkin, you better show out. You better show out. Y'all, I gotta pin this. This is y'all, I mean, this medicine is undeniable. Undeniable. Mama D says her A1C level is 51. Her cholesterol is normal. She is off her blood pressure medicine. Don't come in here fear-mongering us, because our numbers don't lie. The way we feel don't lie. Our 9-scale victories don't lie. Our scale victories don't lie. The way we feel, it doesn't lie. Stick around for a little bit, Whoa. You'll see what it's about. Okay. I love you all. It's after midnight. I don't want to keep y'all. Y'all remember this was an Amble sponsored live. Y'all, this was a really good live. I love when y'all come and, you know, we have a good educational experience. We are here to, you know, I am here to provide a safe place for you to learn, for you to bond with one another, for you to adjust each other's crowns, for us to get facts, for us to get evidence-based knowledge that will empower you, for us to be each other's accountability partners. Y'all know I tell y'all all the time, y'all never have to come in my live and gift. You know, I don't get off on all of those gifting things, but drop some gems, drop something that we can use, drop something that's going to empower your friend in the community, your family in the community, to keep them on the straight and narrow, adjust someone's crown. That's all I really need from you all. Be, you know, engage, drop what new you have eaten this week, what protein you have eaten this week, what vitamin you're taking, what supplement you are taking, so that we all can learn from one another, because it ain't like we gotta prove to nobody nothing. You understand what I'm saying? Because either people wanna get on board and put their longevity and their quality of life in the forefront, or they just want to remain willfully ignorant. And we passed that point. We passed the point of people just remaining willfully ignorant in their health, in their own personal health journeys. We're here for when you're ready, so that we can give you the tools and the support that you need to be successful. We're here to encourage you and inspire you and be your backbone for when you're weak, so you can lean on me, because not every day is a good day. You know, not every day is going to be free from you having side effects, but I'm going to tell you how to treat your side effect. You understand what I'm saying? What did your husband make for dinner? He's sick, friend. He didn't cook. My daughter cooked some spaghetti. Okay, so I love y'all. It's after midnight again. If you guys aren't following me, make sure you're following me. Turn your notification bells on. And if you are wanting to start your GLP-1 journey under the umbrella of Amble, y'all, all you have to do is go to my profile page on TikTok and look for the LINK, and everything that y'all need will be there. If there's anybody in the chat that has a question that you did not feel comfortable sharing in the live, it's okay. DM me. I can send voice messages now. So DM me and I will send you a detailed voice message on whatever it is that you ask me. If you ask me something and I don't know, I'm going to be honest and say I don't know. If you ask me a clinical question, I'm going to refer you to your clinician, because I just educate. Okay, you guys, I educate from my experience using the medication. I educate from my clinical experience as a bedside nurse of 24 years. I don't know everything, and if I don't know, I'm going to tell you. Okay, I love you guys so very much. I do work the next 2 nights, so I will see you guys Wednesday, Thursday, and Friday. Love you guys. You guys have a good night. Bye.